the idea of having a computer that goes for the electronic medical records and can resume the patient's medical history can be a very useful tool that can boost productivity, efficiency, diminishing errors, and let then the doctor do the judgment, applying human intelligence to treat the patient, because we need human intelligence to treat patients.
Machines don't get hungry. Machines don't get tired. Machines don't get fed up of dealing with the patient. And so we need to rethink the position of the human in this new ecosystem. We are still seeing medical schools focusing too much on memorization, too much on classical ways of teaching. We need to think of how humans are going to be co-pilots of technology, and how are we going to reinforce the compassion and humanization of healthcare moving forward, especially because of what Pedro said, where if we do not lower the burden of the disease, the health systems will not become sustainable and they will collapse. People with resources will always get the care they need. The problem is the general population, and those will be left behind.
If you do a quick prompt in one of the bots, and if you ask them to translate to Portuguese, because you know that in English it's a bit different in terms of gender, but if you ask to ask the bot to tell you a story about a doctor and a nurse, we have a lot of doctors here, and we have a doctor who's actually a woman. The chat will translate for a doctor who's actually male and a nurse a female. This is something really important to acknowledge. Everyone has unconscious bias, but this is something that we need to try to mitigate, because if this is going to be our number one source of truth and information for the next few years, we're probably going to be acquiring information that is quite biased, and I think this is something that we definitely need to address.
What I think, if we continue to invest more money in the healthcare practice, in acute care, the money will be always necessary more money. So it's important that we use these technologies in the prevention, public health, in order that we can lower the needs of the healthcare services.
Let's not take the second step before the first, because if we haven't got the right infrastructure, it's very hard to implement these changes in the hospitals, but it's all going so fast.
The patients, they want their problem to be solved. I think this is the first message. They want necessarily to see the doctor or the nurse. They want their health problem to be solved.